The next point here is I want to talk about understanding the AMC Clinical Exam format and why this is important. So as you guys know, AMC has two types of exam, the online and the face-to-face exam. So why this is important is because these two exams are different. They are similar in some ways, but they are different in many other ways. If you are doing either one of these exams, my best advice to you is that you must really understand everything about that type of exam. Okay, so let's move on to the next point. I'll tell you what I mean. So the first case scenario, if you're a person who have not booked for your exam yet, okay, you're still thinking, is the online exam better for me? Or if the face-to-face exam better for me? The first step is you need to ask yourself this question. Which exam can I best prepare for? Of course, you will have a best or the better answer if you know which, if you know both the exams, and if you know what the online exam is and what is the face-to-face exam is, and then you will have a better answer for yourself. And if you are wondering about that, I've made some videos on very detailed about the online exam and also the face-to-face exam. I recommend you watching that and then coming up with a decision. So the next case scenario, what if you have already booked for your exam? So if you already booked for either the online or the face-to-face exam, the next thing that I want you to know or ask yourself is whether you know everything about that type of exam that you have booked. Because it's very important, like I'm telling you, if you know everything about your exam, you will know the advantage and disadvantage. You can learn tips and tricks that are specific for that type of exam. Okay, so the other question you can ask yourself is, what else must I know? Because in my experience, there are some people who think they already know everything. Try not to fall into that group. Because if you think you know, then you're going to prevent yourself from learning new things. That is a danger. You should first recognize that you should not convince yourself that you know everything. You should try to, at least go and find out a bit more and make sure that you cross-check all the lists. All right, let me give you a quick comparison at this point regarding the online exam and the face-to-face exam. So this one is not a very detailed comparison. You might be a little bit confused over here, but let me assure you that my aim here is to just tell you why you need to know the exam format. All right. So if you're doing the online exam, the way you practice is going to be different from the face-to-face exam. So for example, an online exam candidate must practice on a laptop or a desktop or a Mac, anything that is, a computer. So the most important thing is, even if your role play partner is in the same room with you, you both need to use a computer. That is because you need to practice with that computer and try to become comfortable with that. You must know exactly where you need to look. When you are drawing, you need to show, you need to be familiar with how to show that drawing on the screen. So there are a few things that you will practice and you can learn as you practice on the computer. However, my friend, if you're doing the face-to-face exam, if you cannot do it on the laptop, you have to do it in person. There are some time in your practice that you need to actually meet your role play partner and actually perform that exam directly. Because it's important that you are comfortable with the space of being in the same room with another person. And you need to, prepare your face, prepare your motor function to show that, you have been doing this many times so that you are very smooth and comfortable during your actual exam day. Next is the physical examination from examiner. So this is PFE. Some of you may heard of it, some of you may not, but don't worry about that. I'm not going to talk about PFE here today. I'm just going to tell you that in the online exam, there's no PFE. Okay, there's no physical examination from the examiner. What I mean is your communication with the examiner is going to be indirect. Okay, so you are going to speak to the examiner, but you will not be able to see the examiner. So you need to know what sentence you're going to use to speak to an examiner who's virtually not there. And for the PFE in the face-to-face exam, you must know how to, ask the PFE from the examiner. So you see, you get my point. They are different. The online exam and the face-to-face exam are different. And the online exam has prompt timers. Prompt timer is, a little bit of like an advantage for an online exam candidate, because it will tell you how much of time that have already passed. Okay, so for example, if you have a 3 minutes prompt timer, and then after that AMC, they will give you something, either an investigation or a chart or a physical examination finding. So you can know from that point that 3 minutes have passed and you only have a remaining of 5 minutes. So that's an advantage for the online exam, but you don't have that in the face-to-face exam. So you need to keep practicing your role play and sort of get accustomed to what an 8 minutes feel like. And the other thing about the online exam and the face-to-face exam, one of the biggest difference is the physical examination. I mean, this is, it doesn't take anyone to, take very long for anyone to recognize that the physical examination is going to be different. So it is very different. In the online exam, you need to speak out or recite the physical examination. So you are going to have to practice that way. Whereas for the face-to-face clinical candidate, that person needs to perform the physical examination. So it's going to be different. The way you're going to prepare is going to be different. And the reading time in the online exam, it's going to be a full 2 minutes, because that's how AMC does it. Okay, everybody has to get ready before the station can begin. So you will have a full 2 minutes to read. But for the face-to-face exam, you don't have really full 2 minutes. The 2 minutes begins when you exit your previous station and trying to go to your next station. So that is not a long walk. It's a very short walk. But if you are delayed in your previous station, it means that if you're taking your time and trying to speed out a few more points before you leave that station, then you're going to have lesser time compared to other candidates in your reading time. Okay, let's move on to the next point.